So for what reasons am I optimistic that we will actually have a meaningful therapy for traumatic brain injury within the next few years? I think it's based upon my understanding of now where the science has evolved to. We are now understanding a lot about how physical forces injure the brain, so that gives us an opportunity now that we know how they do it, now we know how to prevent it. We now know a lot about the biochemical and cellular effects of a brain injury and how they evolve. And that's, in fact, where drugs have to work. They work at the cellular and the biochemical level. So now that you know how this process is going, you can now intercede appropriately. And that's the work of the pharmacologists as they develop new drugs. Already there's some promising drugs out there. Progesterone is a classic example. That drug is actually in phase 2 clinical trials right now because it already looked very promising in phase 1. Phase 1 was a safety trial, but it still looked very, very good. And now there's a large trial going on, so we're very hopeful. But there are others on the way right behind it, based upon our better understanding of the cellular and chemical processes of brain injury. And finally, public awareness. This is no small thing. The public has to work with us to help us reduce the risks and the risky behaviors associated with brain injury. So all these things are coming to pass right now together. It's almost a perfect storm.